Part A. Extract 1. Questions 1 to 12. You hear a dietitian talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. What brings you in today?
Good morning, Mr. Woodlands. Thank you. Well, it's quite a perplexing situation, really. I've been feeling rather off for a while now. It started insidiously about, I'd say 5, maybe 6 weeks ago. Initially, it was just a subtle fatigue, a sort of pervasive lassitude that I attributed to my demanding work schedule. I'm an independent contractor, you see, a software architect, which means long hours, often tethered to the computer, late nights, early mornings. My typical day involves a lot of sedentary activity, admittedly interspersed with brisk walks, usually a half hour to an hour around the block, just to get some semblance of physical exertion. And my diet, it's always been what I considered relatively balanced. I make an effort to include plenty of cruciferous vegetables, lean proteins, a good mix of whole grains. I'm quite meticulous about reading nutritional labels.
I see. And what are your current symptoms, Mihiraa?
That's where it gets interesting and, frankly, a bit alarming. The fatigue, as I mentioned, has escalated. It's no longer just a mild tiredness. It's an overwhelming exhaustion that even a full night's sleep doesn't seem to ameliorate. I wake up feeling unrefreshed, almost as if I haven't slept at all. Then there's this persistent muscular weakness, particularly in my lower extremities. Climbing stairs has become an arduous task, and even lifting grocery bags feels like I'm attempting to deadlift a small car. And the palpitations. My heart feels like it's doing a frantic little jig in my chest, with irregular, sometimes skipped beats, which is quite disconcerting. I've also noticed a marked increase in paresthesia, a tingling sensation, primarily in my hands and feet, often accompanied by a mild numbness. And the nausea. The nausea is almost constant now, particularly after meals, irrespective of what I consume. It's not severe enough to induce emesis, but it's certainly uncomfortable and has curtailed my appetite somewhat. I've also been experiencing intermittent abdominal cramping, though not consistently. And I've definitely been feeling more irritable, short-tempered, which is unlike my usual placid disposition. I thought perhaps it was just stress, but it's more profound than that.
And have you tried any remedies for these symptoms, Mihiraa?
Oh, absolutely. I'm a great believer in proactive self-care. Initially, I tried increasing my hydration, thinking I might be mildly dehydrated. I was religiously consuming 3 liters of water daily. When that yielded no improvement, I consulted Dr. Wilson, my general practitioner. He ran a battery of blood tests, including a complete blood count, electrolyte panel, thyroid function, and liver enzymes. Everything came back within normal limits, except for my potassium, which was slightly elevated, but she dismissed it as a minor fluctuation. She suggested it might be a viral post-illness fatigue syndrome and advised rest and a course of multivitamins. I took the multivitamins diligently for 3 weeks, ensuring they contained a comprehensive spectrum of B vitamins and magnesium, but the symptoms persisted, even intensified. I also started taking some over-the-counter antacids for the nausea, but they haven't made a noticeable difference. I even tried a detox cleanse, consuming only organic juices for a few days, which, in hindsight, probably wasn't the wisest choice given how I was feeling.
All right. Thank you for that comprehensive overview, Mihiraa. Based on your symptoms and the information you've provided, particularly the muscular weakness, paresthesia, palpitations, and the nausea, coupled with that slightly elevated potassium you mentioned, it sounds highly suggestive of hyperkalemia. Given the chronicity and progressive nature of your symptoms, it's certainly something we need to address promptly.
but Dr. Wilson said it was just a minor fluctuation. What could be causing it?
There are various etiologies for the condition, ranging from renal insufficiency to certain medications, or even excessive dietary intake of potassium, especially in individuals with compromised renal function. We'll need to delve deeper into your medical history and lifestyle to ascertain the underlying cause.
Oh, I see. So, what's the treatment plan?
The immediate treatment will focus on lowering your serum potassium levels. Firstly, we'll need to modify your dietary intake. This will involve significantly reducing your consumption of high potassium foods. This means temporarily limiting items such as bananas, oranges, potatoes, tomatoes, avocados, and even certain leafy greens like spinach. We'll also need to review any over-the-counter supplements you're taking, as some can contain significant amounts of potassium. Secondly, depending on the severity, your doctor might consider a potassium-binding resin, which helps to excrete excess potassium from your body. Thirdly, and this is crucial, we'll need to investigate the root cause. This might involve further renal function tests, urinalysis, and a thorough review of all your current medications, both prescription and over-the-counter. We'll also discuss your hydration status and ensure you're not inadvertently contributing to the issue.
So, it's a dietary change and potentially medication, then? And more tests?
Exactly. The dietary modifications are paramount. We'll develop a personalized low-potassium meal plan for you, focusing on foods that are safe and nutritious. I'll provide you with detailed lists and recipes. We'll also need to monitor your potassium levels closely to ensure the treatment is effective. I'll arrange for you to have a follow-up blood test in 3 days to check your electrolyte levels.
Ms. Woodlands, it's a lot to take in, but I appreciate your clear explanation. Thank you.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, come in and have a seat. So, what brings you to the dentist today?
Hi, Darren. Thanks for seeing me so quickly. The truth is, I've been having this awful toothache on my right side for a few days now.
I see. Can you tell me a little more about the pain? Is it sharp, dull, throbbing?
It's a sharp pain, especially when I bite down on something hard. It comes and goes, but it's getting worse. Sometimes it even radiates up to my cheek.
Okay, and when did this pain first start?
Well, I can't pinpoint the exact moment, but it must have been sometime over the weekend.
It's okay. Anything else would you like to add?
Yes, I remember having some sensitivity to cold drinks a day or two before the pain started.
Interesting. Now, have you had any recent dental work done on that side of your mouth? Fillings, crowns, anything?
No, nothing recent. Actually, I haven't been to the dentist in a few years, I'm afraid to admit.
That's all right, Mihiraa. Have you tried anything to relieve the pain so far? Over-the-counter pain medication perhaps?
Yes, I've been taking ibuprofen, but it only provides temporary relief.
Right. Well, based on your description, the radiating pain suggests there could be an infection in the tooth or the gum tissue.
An infection? Oh dear, that sounds serious.
Don't worry, it's quite common. To confirm and determine the best course of action, I'll need to take a closer look. Let me examine your teeth.
Okay, sure.
I see some swelling around the gum line on your upper right first molar. There's also a small cavity on the chewing surface of that tooth. These findings support my initial suspicion of an infected tooth.
So, what can be done?
There are a couple of options. The most likely scenario is that we can treat this with a root canal.
I've heard that can be a bit uncomfortable.
It's true that it can be uncomfortable, but modern techniques and anesthesia minimize the discomfort significantly.
What does it involve?
This involves removing the infected pulp from the inside of the tooth and then placing a filling.
Is there another option besides this?
In some cases, if the infection isn't too severe, we could try antibiotics and a filling, but depending on the extent of the cavity. Ultimately, the choice is yours. However, I highly recommend treating this infection as soon as possible to prevent further complications.
Okay, I understand. I'd like to discuss this with my husband before making a decision. Would it be all right if I call you back to schedule an appointment, depending on what we decide?
Absolutely, Mihiraa. Please don't hesitate to call us back. In the meantime, you can proceed with the over-the-counter pain medication for pain relief.
Thank you so much, Darren.
That is the end of Part A. Now check the answers.